This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by the woman in you.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. There are many types of energy medicine, both contemporary and ancient. Today we're going to talk about Reiki, an ancient Japanese form of energy healing that is over 2,600 years old. Our guest is Reiki master and teacher Vi Bobola. With over 13 years of teaching Reiki, Vi is owner of Reiki Energy Healing with Vi Bobola and is currently teaching at Collective Souls Wellness Center in New Bedford, Plymouth State University in New Hampshire, and BCC and Salter School, both in Fall River. Welcome, Vi. Thank you for coming on our show.
Thank you, Jackie, for having me. I'm really excited to be here.
Good. Well, Reiki is an ancient Japanese technique. Can you just introduce us to it? Give us a little bit about the history in Japan and how it was used there?
Sure. It actually is 2,600 years old. It was originally used by the Buddhist monks for purposes of enlightenment, more than anything else. So what they would do is they would go and they would meditate on the symbols that Reiki is made up of. And after meditating on them, time after time after time, they emit a measurable vibration. Eventually, it would become embedded in their level of consciousness. And so this is what they would use for purposes of if, they were hungry and they were supposed to be fasting, or if they were having an issue with impatience, or they would go and meditate on the symbols to get past those issues. And eventually, time after time after time, it actually enlightened them.
And what do these symbols mean, these Japanese symbols?
Well, each symbol has a different meaning. One of them works on the physical energy system of the body. One of them works on the mental, one of them on the emotional, and one of them on the spiritual. All the four energies that actually make up the energy system of a human being. So,
did they use those for healing practices after a while?
As far as I know, they did not. When it was rediscovered in 1922 by a Dr. Mikao Yusui, it was then used for purposes of healing.
And so he was a Japanese doctor?
He was also a Japanese doctor, yes.
And so how did it come to the United States?
Well, when Dr. Yusui learned his technique, he opened up what we know as the Yusui Shiki Ryo Gaki, which is really the Reiki Association in Kyoto, Japan. And he in turn taught a Dr. Hayashi, who in turn taught a Mrs. Hawaiho Takada from Hawaii. After Dr. Hayashi and Dr. Yusui died, Mrs. Takada actually brought it into the United States.
Okay, so how did you find out about it?
Well, a long time ago, I want to say about 14 years ago, it happened a little differently. I had a dream, and in the dream I was doing this hands-on healing technique. I didn't know what it was. I had never come across anything like it before. And then shortly thereafter, as what sometimes we call coincidence, I received something in the mail from the Center for Stress Management in Bridgewater, which was a place I had never been before. And so I read the information in the booklet and I thought, that looks interesting. That sounds very much like what I was doing in the dream. And so I thought, I'm going to go try it out. There was a free Reiki share, so anybody could just go in and try it out. And so I did, and when I did, immediately I started seeing the things that were going on in the woman's head who was doing it. And so I started asking her, what are those lines you're drawing? What are those symbols that you're doing? And she said, oh. And she started to explain it to me. And so I thought, I'm going to take a class and see how it works. And after I took the class, it sort of came naturally, and I just kept going with it. So after that, after I received my level 2 degree, I started with my practice, and originally started in New Bedford. And then after about 3 years, I moved into Lakeville, and I was in Lakeville for 10 years up until just maybe like 3 months ago.
Oh.
And I'm back in New Bedford again.
Oh, okay. That's great. So it was developed by Japanese monks who were Buddhists. So how much of it is tied into the spiritual realm?
Because it's made up of all four energies of life force, The spiritual realm is included in that. So when you're doing Reiki for someone, Jackie, it can work on any level. It can work on the physical, the emotional, the mental, or the spiritual. You really don't know what level it's going to work on when you're doing it. Everyone's method of healing it can be a physical dysfunction, but need an emotional healing, or an emotional dysfunction needing a spiritual healing. You never really know where it's going. But the Reiki, because it has its own intelligence, because it is universal life energy, it's what's inside of our bodies, it's already what we have there that heals us when there's something wrong. It's the energy that we live in every day. And the body being familiar with that, once you learn how to do Reiki, and the Reiki practitioner puts her hands on your body is very much like saying, I know what that is, because it's already in there. And it begins to draw the energy from the person's hands.
So
really
does the
neat.
person act as a conduit then for the energy?
That's exactly what happens. The person who is doing the Reiki is the instrument being used to deliver the energy.
And so you're saying that there's 3 different levels of Reiki. Does that mean that there's 3 different degrees? It used to be called like an initiation, but it's really just what would you call it now?
There are different levels, and each level you receive an attunement.
Okay, so it's called an attunement. So like the first level gets a few of the symbols and the second level gets more. How does it work?
The first level you don't get any symbols with the first level. You get them through the attunement itself. What happens is the teacher actually takes the symbols and puts them in your level of consciousness, so that when you're doing your Reiki, they're there. When you learn your 2nd degree level, then you actually get 3 of the symbols to use during your treatment that you can choose to use how you'd like. One of them is for the mental body, one is for the emotional body, and one is used for long distance, so that you can actually send the Reiki energy anywhere you want in the world.
Okay, and then the 3rd degree, that's more for the teachers?
The 3rd degree is a master level. It's definitely a more advanced level. You get the spiritual symbols, which are the most powerful. And you pretty much are in that space where if you're being a master level, then you're really working for the well-being of the world.
And so do you usually, a practitioner will usually say they get 1st degree, would they practice it for a while before they would then, and get used to it before they would go to 2nd degree?
My suggestion would be to get a 1st degree and learn that and be comfortable with that. Know what you're doing before you move on. I do know people who do 1st and 2nd back to back. And in my own personal opinion, and everyone is different, but in my own personal opinion, I would suggest that you do 1 level at a time and get comfortable with that before you move on.
All right, so let's talk about how it's used in hospitals today, and just to back up a little bit, is there any medical research behind it, since it is used in hospitals today? And I want you to talk about the ways in which it's used. Has there been medical research behind this?
Okay, I personally have had a couple of experiences. I've been able to go into Charlton Memorial Hospital and do Reiki for people during deliveries of their children, which is an excellent experience.
So is it calming? Or?
It's very calming. There are meridians that activate the uterus that you can hold. When you learn Reiki, you learn what those are. So it not only is calming for the woman delivering, it's also actually doing something to help the process along. There are people who actually come into the office when they're ready to deliver and say, okay, let's go. I'm ready. So I've been able to do that, which has been really wonderful, a wonderful experience. I've also been able to go into Beth Israel Deaconess in Boston and do Reiki for someone during surgery. This was very interesting because I'm not a nurse, and not being a nurse, I thought, I wonder if they're going to, how this is all going to work. And so going in, the woman that I was Reikiing originally wanted to use Peggy Huddleston tapes.
Yes.
And the doctors said, you know what, no, we're not doing that. So she said, okay. He said, if you want, you can put on your little cassette player and you can listen to it that way. So when we got into the operating room, she said, would you mind terribly giving me positive affirmations? So I said, no, that'll be fine. I'd be happy to do that. So while I was Reikiing her, I was Reikiing her at her head. The anesthesiologist was there. The doctor and the nurse were there. And so I started just giving her positive affirmation while I was Reikiing her. And through the course of that time, the anesthesiologist said, oh my gosh, what are you doing? I feel really good. So, I just started laughing and tried, explain to him a little bit about what I was doing. And when we were finished with the whole thing, the doctor came over and said, this was wonderful. Everybody should have an advocate like that. And I thought, what a nice thing to say, because he really didn't have to do that.
Yeah.
Yeah. So it worked out really well. Not only did the surgery go well, she left the hospital sooner than normal.
And
so it was good. So we also went in and did Reiki for her after her surgery.
Yeah. So it does very much relax and allow
does.
the healing to speed up. And
it really does.
and you use it also for hospice care.
I do. I'm presently employed by Overlook Hospice in Dartmouth. And at Overlook Hospice, they do incorporate alternative complementary medicine therapies for their patients, which I think is fabulous.
Yeah.
I have worked volunteering for hospice for probably on and off 10 years.
Wow.
And I have had some wonderful experiences. It really does, if someone is passing over, help them leave the body easier than not. I have learned in my, from watching some of the things that I've seen, I feel personally like sometimes it is as difficult to leave the body as it is to birth. So it's really nice when you can see them relaxing. Originally I did it for hospice and it was charted. And the person that I was working with used less medicine, morphine, than what she normally would have used. So she was able to have a much better level of consciousness to be with her husband and her family at the very end than just, not being comatose or being comatose and not knowing what was going on.
Yeah. And so the hospitals have allowed it to come in and they've run some studies, haven't they?
They really have. There's actually a few of them now. Years ago, probably like maybe 7 years ago, I want to say, I went into St. Luke's in New Bedford and I was teaching Reiki there for them. Had gone in and done a talk for the operating room staff and the recovery room staff, and that was kind of interesting. And it was really nice to do that. And then I started teaching in there for a while so that the nurses could learn how to do Reiki. It's really wonderful for them to know because they're right there with the patient.
Yeah.
If they had a little bit more time to do it, it would be absolutely great. And I know it's hard for them because they're busy to do all the other things that they have to do.
Yeah, yeah.
Brigham and Women's has done a study recently, very recently, like since February, this past February of 2011, where they've actually done 6,500 treatments, 20-minute treatments, and have found that the people that they have worked on have either recovered faster, they've had much more relaxation, less anxiety. So they are still now, I believe, doing study with that. And you can now go into Brigham Women's, and if you're undergoing, I believe it's the cardiovascular. If you're doing, let's see, what else? Cardiovascular oncology. They have treatment in there that you can receive Reiki for. Reiki really helps with chemotherapy and radiation. It helps relieve some of the side effects. It doesn't interfere with any treatment that you're doing. So it doesn't matter if you're doing dialysis, radiation, chemotherapy, it's not going to interfere with it, it's only going to help it.
So the doctors are starting to get used to seeing it in the hospitals or in the medical centers?
They really are.
And you teach Reiki, and you teach a CEU, continuing education
Correct.
credits
I do
for
offer,
nurses?
Yes, I do offer CEUs for nurses. Also, massage therapists need CEUs, so anyone who can use them, whoever does a Reiki class, I can award them CEUs for that within the state of Massachusetts.
So is there a story you'd like to share with us? Maybe something that's happened recently or in the last 6 months that's kind of really warmed your heart and made it
There are
rewarding?
a lot of stories. I really tell my students when I'm teaching them, if you can journal, because you're never going to remember all the things that you see change. So I'll give you a couple of little ones. Most recently, there was a woman that I worked with who had sinus work done. And the work that she was having done, because
Meaning a surgery.
a surgery, and
Yeah.
I'm sorry, yes, because of the way the structure of her face was, the doctors were going to have to go in and open her skull to go in. So it was going to be really intense for her. And she came in and she just said, you know, I'm willing to try anything. Let me try this. I've heard really good things about it. So she came in and we did 4 treatments for her. And generally, if you're working on something like that, you want to do a minimum of 4 treatments so that your body can really take in as much as it can. And so we did that. And by the time we were done, I just made a suggestion, because you never really know what goes on in the body. Said, you know, make sure that you have them recheck and make sure that everything is in the same alignment as it was originally. And so they did. And when they went, she actually went in for the surgery. They didn't have to do anything. The Reiki actually moved the whole structure of her face.
Wow.
It was really incredible experience for her.
So she didn't have to have this sinus surgery at all?
She had to have the surgery, but they just went right in through her nose.
The way they
didn't
usually-
even have to cut, which was really nice.
Wow.
Yeah. And very recently, and it happened to be a relative of mine, my sister-in-law, went in for hysterectomy. So, of course, being in the family, I said to her, let me give you a Reiki treatment before you go in, so that just the anesthesia and everything that you're going to undergo, once you cut into the body, it goes into trauma. So just the trauma of the body itself, let me give you a Reiki treatment so you'll feel better. So we did. And then she had her hysterectomy, and when she came out, I met her at the house and I Reiki'd her again the day that she got out. And I went over one other time, and when she went back to her doctor 3 weeks later, she was totally mended inside. And he said, oh my gosh, what happened? And so she in turn had said to him, oh, this is what my sister-in-law is doing. And so we have recently been in contact with each other. And so we are in conversation about, what the potential is for that.
That's great.
It is good.
It is good.
It is.
So where do you see the future of Reiki in contemporary medicine? What are your hopes for it, and what do you think will happen?
Jackie, right now, seeing everything that I'm seeing, having done this for 13 years, the very first beginning part of when I started, there were a lot of people who used to think it was more occult and it just works on the spiritual, and this isn't something I should be doing. And I do believe that people are recognizing that that's not what it is at all. That it really is a technique that works on the body no matter who you are or what you are, as long as there's a living force going through it. And in recognizing that, people are now seeing, so it's been here a while, this is going to stay, it wasn't a fad that came in and went out. Let's take a better look at it. We heard a lot of stories about it. We can't guarantee anything, but let's take a look at it, because these things just keep happening. And so the medical community is now in a position where they're working with so much energy that they can't see or don't know what it's about, the metaphysics of the whole thing is saying, let's look into it a little bit more. And so they are, and they're finding that when people are getting Reiki, in things like, especially things like, let's say, broken bones, when somebody puts their hands on them, the blood is coming to the surface of what needs to be healed. And so because there's more blood flowing through that area, they're finding that the body is healing quicker.
Mm-hmm.
So whatever it is that's happening, it's getting results.
And so when you're working on it, it does work on all levels, the physical, mental, emotional, and spiritual.
Absolutely it does.
Okay.
And I really do see the medical community embracing it more and more and more, especially with all the oncology we have going on.
Yeah, yeah.
I mean, I think that it would just make sense to try and make someone as comfortable as possible if they're in a lot of pain.
Yeah, and they've been welcoming hypnosis. They've been
Yeah.
welcoming Peggy Huddleston's work, which is scientifically based. She's had a lot of studies behind that, a relaxation technique, and so now we can see Reiki taking its place, probably just according to the personality of the hospital, basically.
Yeah, and it's good for everyone. I mean, anyone who undergoes stress, anxiety, it really makes you feel comfortable.
And is it something that you can do for yourself and take home with you? Like if you give someone a session, what do they experience, and can they continue to perpetuate this healing once they get home, or do they have to keep coming back?
When you get a Reiki treatment from a Reiki practitioner, you would come in, you'd lay on a table fully clothed. It's very non-invasive. That Reiki practitioner would probably have a very relaxing environment set up for you.
Mm-hmm.
You might hear, music playing in the background. The lights would be dim. You might have an eye pillow or a fountain, something that's going to be very calming. And you might experience a hands-on the body, of course not touching the bathing suit areas, and that with that comes a sensation for most people. And that sensation can be warmth coming from the practitioner's hands, a tingling sensation going through their body. Some people say to me, I feel really heavy, like I have weights on my shoulders. Other people have said to me, I feel very light, like I'm floating off the table. It's different for everyone. They're just sensations. There's no wrong sensation for the body to experience. And when a person receives the treatment, that treatment is over in about an hour and 15, 20 minutes, but the Reiki stays in the body for the next 24 to 48 hours. And I usually will say, make sure you drink a lot of water before, over the next couple of days, because whatever's going on in the body has to go back to where it came from, which means it's going to end up in the body. So the more water you drink, the more you're going to flush the toxins through.
Mm-hmm. And so what are your typical clients like who come to your work, who come to your office for treatment?
They come for all different things. Some of them come for headaches. Lots of them come for stress. Mm-hmm. Some people come for broken bones. Some people come for prior to surgeries. Some come for just before deliveries to get things activated and rolling. They come for all different reasons. For some, it's just all emotional, just to get their emotional bodies intact again. So it's really neat. I like it. I really enjoy doing it a lot. I love teaching people because you can do it for yourself. Once you know how to do it, you can do it for yourself.
Yeah.
And once you're a Reiki, you will be a Reiki forever. So whether you choose to practice it or not doesn't matter. When you decide to pick it up again, it's there.
We've covered a lot. Is there any thoughts you'd like to leave us with? Anything that we didn't cover that you think is really important for people to know, either about Reiki or, how to get in touch with people who practice Reiki and so forth?
There are a lot of people doing Reiki now, more than you can imagine. I'm trying to think. I don't even think there's anything in the directory right now in the telephone.
So you mostly
directory.
see like maybe a massage therapist or somebody who would also incorporate the Reiki in with what they do?
There are a lot of
mostly.
massage therapists who incorporate Reiki. There are a lot of massage therapists who come to learn Reiki because you can feel the difference
Yeah.
as a practitioner when you're doing massage therapy. There are many centers now of integrated medicine that chances are they're going to be doing Reiki in there.
There's going to be someone in there doing
Yeah.
Reiki.
Yep. In all of the mind-body centers in Boston, absolutely they're doing it. And here locally, they don't call them mind-body centers. We call them alternative therapies and, complementary therapies, and that's what they're doing. That's what it's all about. It's all about being able to find a balance for people that will work well with medicine, that will help alleviate some of the side effects, because some of the side effects are very profound, and be able to make a choice as to what they want to do.
Well, Vi, thank you so much for joining us today and telling us all about Reiki and your work that you've been doing here. It's been a pleasure to have you.
Thank you so much. I'm really grateful that you were able to do this, because I think the more information that goes out there, the better that we're all going to be evolving into this next level of consciousness that we're going into.
For more information, you can visit Vi Bobola on Facebook. You can also contact her at 508-947-4200 or email her at vbreiki, that's R-E-I-K-I, at Comcast.net. Thank you for joining us today as we've learned more about the ancient healing art of Reiki with our guest, Vi Bobola, from Reiki Energy Healing with Vi Bobola. I'm your host, Jackie Bell. Join us next time on Living Healthy.